Welcome! In this explainer, we're going to tackle a topic that's super common but can feel a little worrying and is definitely not something people talk about at the dinner table. We're talking about prolapsed hemorrhoids, and we're going to break it all down into a really clear guide. So here's our game plan. We're going to start with the basics. What are these things anyway? Then we'll get into the symptoms and how doctors figure it all out. After that, we'll dive into all your options for relief and, finally, wrap up with how to prevent them in the first place. Sound good? Let's get into it.
Okay, first things first. What exactly are we talking about when we say prolapsed hemorrhoids?
To put it simply, think of it like this. We all have hemorrhoids. They're just normal vein cushions inside the rectum. A problem only starts when those veins get swollen and then get pushed out of the anus, usually from things like straining. That pushing out is the prolapse, and that's what causes all the trouble, like the pain, itching, and bleeding. So now that we have a better idea of what they are, how do you even know if you have one? Let's talk about the signs and symptoms you might notice. The number one sign, the one that gets most people's attention, is seeing bright red blood. You might notice it on the toilet paper, in the toilet bowl, or on the stool itself. But that's not the whole story. You could also have some pain or general discomfort, annoying itching, or even a feeling of fullness, almost like something is still there. And let's be real for a second. Seeing blood can be pretty alarming, right? It's totally normal to feel concerned about that. And that's exactly why the best advice, hands down, is to get it checked out by a doctor. Don't guess, get an actual evaluation. So you made the call and you've got an appointment. What's that going to be like? Let's walk through how doctors get to the bottom of it and give you some real answers. It's actually a really straightforward process. It all starts with a conversation. Your doctor's just going to ask you about what's been going on, your symptoms, your diet, stuff like that. Then there's a simple physical exam to check the area. And from there, if they need a closer look, they might move on to some specific tests to get a crystal clear diagnosis. Now, to get that better look, doctors have a few different tools. It might be a simple digital exam, or for a direct visual, they might use something called an anoscopy. It's just a small tube with a light on it. If they need to see a little further up, they might use a slightly longer tube. And sometimes, just to be safe and rule out other causes of bleeding, they may recommend a full colonoscopy. Okay, this is really interesting. Based on that examination, doctors will actually classify the hemorrhoid on a scale from 1 to 4. Grade 1 means it's still inside. Grade 2 pops out but goes back in on its own. Grade 3 pops out and you have to, manually push it back in. And grade 4 is just always out. This grading system is super important because it directly guides what kind of treatment is going to be best for you. All right, so you've got the diagnosis, you know the grade. Now what? The next step is all about relief. And the really good news here is that there are so many effective options available. And this is the best part. For most people, relief starts with things you can do right at home. I mean, look at this list. We're talking about simple but powerful changes. Eating more fiber, drinking more water, not sitting on the toilet forever scrolling on your phone. Even something as simple as a warm, shallow bath can provide a ton of relief. But what if those home remedies just aren't cutting it? Well, then your doctor has a few tricks up their sleeve. These are minimally invasive procedures they can do right in the office. They all kind of work the same way. The goal is to cut off the blood supply to the hemorrhoid, which makes it shrink and fall off. Things like rubber band ligation or sclerotherapy sound intense, but they're actually very quick and effective for a lot of people. Now, when we say surgery, I know that can sound scary, but it's really important to know that this is not the first option. It's usually reserved for those more severe, grade 3 or 4 cases that just haven't responded to anything else. In those situations, a procedure called a hemorrhoidectomy might be the best way to go. All right, we've covered what they are, how they're diagnosed, and how they're treated. Let's finish up by talking about how to stay on the right path and prevent them from coming back. And we'll also touch on potential complications. Wait a minute, does this list look familiar? It should. The absolute best ways to prevent hemorrhoids are the exact same habits we use to treat them. Eating more fiber, staying hydrated, not straining. It just goes to show you how powerful these simple, everyday choices really are for your long-term health. Now, when we use the word complications, I want to start with a big dose of reassurance. For the vast majority of people, complications are rare. This is usually a very manageable condition. That being said, there are two main things to be aware of. First is anemia, which can happen if there's a slow but steady blood loss over a long time. The other, which is much more serious but also much rarer, is called a strangulated hemorrhoid. That's when the blood flow gets totally cut off, causing a lot of pain. If that happens, it's a medical emergency, and you need to get help right away. So what's the big takeaway here? After looking at everything from diagnosis to surgery, it seems like it all boils down to one simple question. Could a few simple lifestyle changes be your best defense? And all the evidence points to a huge, resounding yes. Being proactive with your daily habits isn't just a good idea, it's the most powerful way to find relief and keep this problem from coming back.